What you see behind me is the helicopter path of the University Hospital in Frankfurt. You see the beautiful skyline, but the photographer was cheating, was pushing it together, so it looks more impressive for you. So let me take you on a little helicopter flight through the human body and blood. Who is a medical person? No, who's non-medic in this room? I thought so, don't worry. There's two things you have to learn. Let's start with number one. What is anemia? Anemia is the number of red blood cells or hemoglobin in the blood when it's reduced. That's anemia. I will ask you later on, so please do not disappoint me, please. And what are the symptoms? Fatigue, sometimes palpitations. Women very often complain about thinning of hair. The hair are breaking or the nails are not that nice anymore. Keep this in mind. The second thing I'm asking you is to know what patient blood management is. You see it on my shirt, you see it on my tie. I'll show you later more. This is all about measures to reduce the amount of blood we are taking from you. We try to preserve your own blood. Let's keep it like this. So, we're all getting older. That means our society is getting older. We're having more medicine being done in age. So, it's normal nowadays to have patients 90 plus on my intensive care unit. And there are people who participate in life. But they're coming with anemia to the hospital. And you can see, I try to translate for you what you will have later on, a glass of red wine. And the glass, you can see, is only half full. I'm a positive person. I could have said half empty. No, it's half full. So the elderly lady comes to the hospital and then sees the biggest enemy of the patient. That's me, the doctor. We make it worse. As you can see, the glass is getting even more empty. So going to the hospital can be good on one side, on the other, it's a threat to you. But I'll explain you in a minute why. If you look at this, the Bill Gates Foundation, they have done a survey about the leading global health problems. And what you see, and probably none of you know that, number 4, regardless where you live in the world, in America, Sub-Sahara, it does not matter. Iron deficiency anemia is number 4 problem of humankind. Number 4. If I look in this room, I can tell you there are about 150 people of you who are anemic. 150. So it's every 4th. And I can pick up and I can tell you, you look like you maybe. I'm not doing this. But if we go further, and now it's getting very interesting. If we take all form of anemia, it's the number 1 disease of humankind. There's no other disease is more common than anemia. Did you know this? I can't hear anything. Thank you, you didn't know this. Excellent. So, what is all about? You heard a little bit about blood. So, doctors are vampires. I'm a vampire. We take a lot of blood of you guys, and it's not fair. Because we should be like little mosquitoes and taking only a little bit blood, because it does work. What we have done in Frankfurt, we were asking the question, can we not use less blood for testing, same quality, everything the same? Yes, we can. But the process of changing a tubing system like this took us a year. Because you have to change the ingredients, you have to change the inner part. It's a really unbelievable amount of work. But we have done it, and we are saving now at the University Hospital Frankfurt 2,000 liters of blood every year, what we are not taking from our patients. 2,000 kilograms. It's unbelievable. So now we're coming to the most important thing tonight, which is the palace says Philip to have planned surgery. So my question is now to you, and you need to answer this question. How full is a glass of Prince Philip? Is it full? Is it half full or half empty? So, who's answering the question? Half full. So, who's the guy? Come over, you get my tie. Come here. So it's a little Christmas present. So you have the... Can you give it through? So because that now I've saved my life because my neck is getting a little bit tight. So the question is, yes, the glass is only half full, with Prince Philip. And I tell you now what that means. And this is what you don't know. And I'm telling you now the truth. And what you see on the left side is a big study with over 220,000 patients undergoing elective surgery, planned surgery, hip surgery or nose job or whatever, plenty of time to organize this, and then you have the surgery. If patients had no anemia, on the left side, glass is full, mortality, so the risk to die was less than 1%. Excellent, perfect. If the glass was only half full, so mild anemia, that's what we call mild anemia, hemoglobin 9 to 12, and I'm telling you, 1/4 of you have a hemoglobin less than 12. If you have surgery then, your risk to die increases by a factor of 5. 5 times more. And if you have a higher degree of anemia, it goes up by 13 times. So, your doctor is telling you suddenly, oh, we do this beautiful operation, beautiful surgery, and your risk to die is 13 times higher than someone. What are you saying then? No, doctor, no surgery at the moment. Please sort out my anemia first. That is what you would say, unless it's your mother-in-law you don't like. But anyway. What does the WHO, the World Health Organization, saying? They have a definition over 60 years old about anemia. Men, 13, please remember this. If it's less than 13, a man has anemia. Women, 12, then they have anemia. But, now comes a big but. Look, on the left side, the man, big muscle man, 90 kilogram, pure muscles, blood volume of 6 liters. Or the tiny moderator we just saw, only 3.5 liters of blood. So now, the surgeon comes with a knife and cuts the skin. And it's bleeding. 1.5 liters of blood. It's bleeding. The man ends up with a hemoglobin of 9.8. Not the moderator now. Some sort of lady, 6.9. So you're probably saying, what does it mean? It means the woman will be transfused. And this is actually the most common situation, women, healthy women, whatever, being transfused. Because we are not respecting a different physique. Have you ever heard about transfusion? So what do you think is the risk to attract HIV through transfusion in the Western world? Very high, very low? Very low, excellent. Is it the chance to attract HIV as dying through an air crash? Yeah, almost, I'll show you. HIV and hepatitis C nowadays, it's more likely dying in an air crash or almost the same, but the chance for you to die of lightning is higher than attract HIV. Can you imagine? So now look to the right side of the slide and you see something which is called TACO. Transfusion-associated cardiac overload, 1 in 100. And this kills people, nobody tells you. It's very, very common in the hospital, and it's extremely dangerous. This is common. So if you're going to the doctor in the hospital, someone tells you you might need a transfusion, whatsoever, and they tell you all about HIV, forget about it. You want to know how high your risk is to have an allergy or an TACO. That's what you want. So, we have translated our knowledge now to the Frankfurt anemia definition. And we are not allowing anymore women to have a hemoglobin less than 13 for planned surgery. And you can see the same thing. The surgeon uses a knife, cuts open the abdominal cavity, 1.5 liter of blood, and suddenly the woman has only a hemoglobin of 7.5, no transfusion. That means I'm standing here today to lift up women. We have to carry women. We have to treat them like queens in medicine, at home anyway. But in medicine, we have to treat them really like queens. So I'm urging you, when you're going home, to take this message. So very briefly, and I know I'm getting something in the microphone in a minute. Preoperative anemia, you should know. If you have anemia, you go to the hospital, you have surgery, your chance to stay in hospital is 20% longer. You have a twofold increased risk for infection, 4 times increased risk for kidney injury, 3 times more deaths, and 5 times more transfusion. And if you translate this we are WORLD.MINDS, on a world scale, we have 324 million surgical interventions. 100 million of these patients have anemia. And I've just shown you what happened anemia and surgery. We could save every year 10 million lives. That is a number, I don't know any treatment in the world which can save 10 million lives. And we have translated this in a clinical trial. You can see 54,000 patients, 4 centers. Center 1 is the University Hospital Frankfurt at the time, where we had no patient blood management, 3 months of heavily teaching, training, nurses, doctors, and then 75,000 patients enrolled in patient blood management. And now I need your help. What do you think about transfusion? I need all your thumbs. I'm nearly done. Lift up all your thumbs, please. So tell me, transfusion, up, same or down? What do you think? 20% down. What about complications? Down. What about costs? Down by 10%. We know now if you have a hospital with 1,000 beds and you do PBM, you save 1 million euro every year in direct costs. And we are down now to 40% less transfusion. And this is my final slide, and this is where I need you. We started a network in Germany in 2014, and then a European network and a global network. And unfortunately, we have only 160 hospitals. So the chance that you're going to a hospital or is not doing the right thing, what I've just shown you today, it's extremely high. So use your networks, spread the message, and help yourself and help other patients in the future. Thank you very much.